2.6 billion people live without access to basic sanitation, such as latrines, as well as hand-washing facilities. In areas without sanitation, contact with feces occurs in daily life, which causes various diseases. In particular, diarrhea claims the lives of 1.5 million children under the age of 5 every year. This is the second major cause of mortality for children under 5 in the developing world. About 88% of these deaths result from unsafe drinking water or the lack of improved sanitation. Here, we will be looking at sanitation and hygiene, in particular at efforts to improve them in rural areas and how we can advance these support efforts in the future. By 2015, halve the proportion of the population without sustainable access to safe drinking water and basic sanitation of 1990 levels. This is one of the Millennium Development Goal targets, but it also contributes to other targets such as achieving universal primary education, promoting gender equality and empowering women, and reducing child mortality. Also, with the recommendation of the United Nations Secretary-General's Advisory Board on Water and Sanitation, 2008 became the International Year of Sanitation. Then in January 2010, at the follow-up conference of the International Year of Sanitation, future issues to be dealt with and directives were discussed. As noted, there has been great recognition in the international community of the importance of sanitation improvements and a growing need for international cooperation in improving sanitation facilities and hygiene behaviors. Japan is the top donor in the water sector, accounting for more than 30% of bilateral aid. Thus, it is all the more important that we fulfill our responsibility in sanitation, another part of the water and sanitation field. We take a deeper look now at the importance of improving sanitation and hygiene. This is a comparison of access to safe drinking water and sanitation in 1990 and 2008. Here we can see that compared to improved water sources, the spread of improved sanitation facilities are significantly behind. It is important to approach sanitation improvement considering these 5 aspects: health, development and the reduction of poverty, gender, education, and human dignity. The lack of appropriate facilities and hygiene behavior are the cause of various water and sanitation-related infectious diseases. In order to live a healthy life, improvements in the sanitary environment are vital. Since many poor people live in poor sanitary environments, many suffer from water-related diseases. This leads to the problem of becoming mired in poverty, as illness leads to increased medical expenses, while incomes drop as a result of being unable to work. Women in particular may not wish to go to defecate during the day where they can be seen. Also, by going to deserted areas, they may be subject to sexual harassment. Thus, it is important that sanitation facilities are located in safe locations where privacy can be maintained. For girls, being unable to safely use sanitation facilities at school can be reason enough not to attend school, leading to a decline in the female enrollment rates. Also, where water supply systems are inadequate, some children are unable to attend school due to the time and effort required to collect water from water sources. Living in a sanitary environment is also important from the perspective of simple human dignity, or living like a human being. By working on improving sanitation with these 5 aspects in mind, it is possible to contribute to all of the Millennium Development Goals. We will now take a look at the transmission routes of infectious diseases related to water and sanitation, and how to block those routes. To prevent infectious diseases, it is important to first understand the infection routes of diseases. In many cases, diarrhea is caused when the pathogens in feces directly or indirectly enter a person's mouth. This figure shows the routes. Fecal matter can come into contact with foods and mouths unnoticed. Feces is spread by rain, contaminating the water in rivers or shallow wells. Fingers come into contact with the stool during defecation. Flies gather around fecal matter, or open defecation can contaminate fields. Because all of these intermediaries begin with the letter F, this diagram is known as the F diagram. Infectious diseases, which take these kinds of infectious routes transmitting feces to people's mouths, are known as fecal-oral infections. Developing symptoms include general diarrhea, cholera, typhoid, dysentery, hepatitis A, polio, and ascariasis. To prevent oral fecal infections, the routes of infection must be blocked. First, there must be a supply of safe drinking water, free from feces contamination. Sanitation facilities such as latrines should be built not to pollute the living environment with fecal matter. Hygiene behaviors should be improved, such as washing hands with soap and boiling and correctly storing water. And water quantities necessary for these hygiene behaviors should also be increased. There are also many other diseases that can be prevented in this way, not only through the supply of safe drinking water, but through improvements in rural sanitation, such as building sanitation facilities and improving hygiene behavior. Eye infections like trachoma, estimated to annually cause blindness in 6 million people, and the skin disease scabies are both said to be preventable by thoroughly washing hands and faces. There are also said to be about 200 million people around the world infected with schistosomiasis, where schistosome eggs are discharged from the urine or feces and flow into fresh water where they infest the body of snails and then invade the human body through skin that comes in contact with the water. One way to prevent this, sanitation facilities need to be improved so that sewage flow is contained. There are in fact many infectious diseases that can be prevented by improved sanitation. To improve sanitation conditions, in addition to the first stated political commitment, there needs to be both support in hardware and software. The hardware being the sanitation facilities and hand-washing facilities, and the software being hygiene behavior, including continuous use of these facilities. First, we will take a look at the hardware of developing sanitation facilities that are suitable for warm tropical areas. There are many types of sanitation facilities, from a hole in the ground to more advanced types. This illustration is called the sanitation ladder, showing the gradual improvements in sanitation conditions. With the aim to improve the current situation, facilities are selected based on the condition in which people are living and their ability and willingness to pay. As indicators of the Millennium Development Goals, these types of facilities are defined as basic sanitation. Here is a pit latrine with slab, where a hole is dug in the ground and a lid is fixed to a squatting slab or platform. This has low installation cost, a simple mechanism, and can be easily made, but has problems with flies and odor. Next is the improved ventilated pit latrine. The installation of a vent alleviates problems with flies and foul odors. However, in order to prevent flies from coming indoors, rooms must be kept dark and there are additional costs of ventilation pipes and screens. This is known as a pour flush latrine, with a small amount of water poured by hand. Many cultures use water to wash their buttocks, and since this water is sealed, there are no problems with foul odors or flies. But water is required for flushing, and hard materials cannot be flushed. Here is a flush toilet connected to a septic tank. If the sludge is regularly removed, this can be used semi-permanently. However, care must be taken in the handling of sludge. It requires large amounts of water for flushing and suitable ground for seeping of water that has been treated with a septic tank. Japan also has a technology called JICA-Net. But this needs electricity and money in order to operate, meaning that it can only be used in limited areas. This is a composting toilet. Water is not required, and after the sewage is treated, it can be used as compost. There are different types, whereby ash is added after defecating, or treatment is conducted by heating. But since they all make compost, care must be taken when using them. It is very important that the toilet is cleaned and, depending on the type, sludge removed, and that it is maintained regularly and used continuously. Furthermore, to prevent contamination of drinking water, care must be taken in terms of distance between water sources and sanitation facilities. Next, we will consider hygiene behavior. At times, even with sanitation facilities in place, they are left unused. Rural sanitation will not improve unless the practice of local people are based on understanding of why they should use the toilet and why they should wash their hands after defecating. In other words, the improvement of sanitation and hygiene-related customs and behaviors of the local people is an important element. One approach to improving hygiene behavior is to promote hand washing with soap, highly effective in preventing infection. Organizations such as WHO, UNICEF, and private soap companies have become involved with international activities like World Water Day, promoting adequate water supply for everybody, and the Global Hand Washing Day, promoting hand washing with soap. A number of approaches have been proposed to work with local peoples and improve their hygiene behavior. Of these approaches, we will take a look at CLTS, SLTS, and FAST. CLTS is a participatory approach to encourage communities to stop open defecation. community members are facilitated to analyze their own defecation behaviors and community sanitation profile to collectively improve their sanitation status. NGOs and donors assist communities in awakening in this way. For example, community awareness is increased by taking them to areas where open defecation has occurred and triggering a feeling of shame or shock. Also, by effectively stimulating community pride, contests can be used to award communities that achieved zero open defecation. With CLTS, subsidies are not provided for individual latrines. Latrines are made to fit each family, with support within the community. By aiming at eliminating open defecation, the first step is taken to ensure that everyone can use better sanitation facilities. SLTS is a similar approach which begins with schools. Children learn about improving sanitation at school and then share this with their families and others to spread improved sanitation throughout their community. CLTS and SLTS steadily began spreading from the early 2000s. But sustainability could be an issue, as communities can return to open defecation once they lose interest. FAST is a 7-step program for the prevention of diarrhea. Through detailed workshops led by facilitators, community members are led to analyze sanitation problems for themselves, consider solutions in stages, and implement improvements. This is a participatory approach, whereby communities are empowered to improve their own hygiene practices, build and maintain water supplies and sanitation facilities, and make improvements to their sanitation environment. There are many other approaches also, including social marketing, but it is important to utilize the best approaches based on the conditions suited for the area. Now, we will look at an example of JICA measures in action. Madagascar is a Southeast African island nation in the Indian Ocean. It has an area 1.6 times that of Japan, with a population of 20 million. Madagascar has a great deal of cultural and ethnic diversity, being at the intersection of Asia, Africa, and Europe. The Atsimo-Andrefana region is in the southwest and is a thriving agriculture region consisting of 9 districts. However, it has a dry climate with low annual rainfall and constantly has water shortages. Even today, it has few sanitation facilities, and open defecation is a daily occurrence. Here, JICA dispatches experts for a project to provide maintenance and management support for water supply facilities and sanitation improvements. The sanitation component of this project is conducting sanitation-related educational activities at the community level, aimed at promoting improved hygiene behavior. Assistance is also provided to develop systems for continuous education related to sanitation at the elementary school level. Specifically, training is provided for teachers at the regional and district levels in hygiene education. Training support is also provided for volunteer health workers who implement these activities at a community level. And training aids are provided for elementary school teachers. Here, sustainability is ensured due to the cooperation of the Ministries of Health and National Education. The Ministry of National Education promotes sanitation education activities at the elementary school level, while the Ministry of Health supports awareness and behavioral change activities for the prevention of infectious diseases. Instructors from the central government's Ministries of Health and National Education train regional level teachers. Then, teachers trained at the regional level provide training for volunteer health workers and elementary school teachers. Then volunteer health workers and elementary school teachers work to educate the local community and children. Let's take a look at what kind of activities are actually taking place at the Ministry of National Education. The counterpart for the sanitation component are teachers from branches of the Ministry of National Education who train teachers at the various schools and district offices. We support the principals and teachers at elementary schools in educating children about sanitation and water use, so that they will put their understanding in practice. Teachers in district offices that have received sanitation training then train individual elementary school teachers. Then those teachers that have received training teach the children. We will now take a look at how sanitation is taught in elementary schools. This elementary school has VIP latrines at its sanitation facilities. Flower beds are planted so that the children will be interested in the latrines. Hygiene education involves the correct way to wash hands. Next, the correct way to use the latrines is taught. The children appear familiar with the lesson, and for good reason. We give instructions to the children with hygiene education as part of the curriculum once a week. Through weekly hygiene education, children learn the importance of sanitation. They also clean the latrines. They don't forget to wash their hands after using the latrines. There is even a song to sing while drying their hands. These are hand-washing devices made from plastic bottles by a principal that has received training. The used water flows directly into the flower bed. Through these educational activities, the awareness of the children has changed. It also appears to have brought about good changes for the school. Through hygiene education, student illnesses have been reduced, and attendance has improved to 95–96%. Children have also started telling their friends and family about hygiene. It is hoped that these kinds of sanitation activities in elementary schools will continue to improve the awareness of the children and will be passed on to their families and communities. Next, we will look at the flow from the Ministry of Health. There are three important issues when conveying hygiene education to the general population. The first is access to clean water. The second is the correct use of toilets. The third is washing hands. In order to educate communities in these things, it is necessary to develop volunteer health workers on an ongoing basis. Instructors in district offices receive guidance from the Ministry of Health, and they then train instructors in health centers. The health center workers then train volunteer health workers. These volunteer health workers provide hygiene education to the community people. A variety of materials are available to help teach in a simple manner. A distinct feature is that these can be made inexpensively by anyone and are easy to disseminate. Hygiene education activities are also carried out using skits. Skits are used to teach in a simple manner the importance of boiling and then drinking only clean water in order to avoid diarrhea.
Dia tsy maintsy andesiko fa zany zay fampianara azy satria scoutisme aho dia mpampianatsy sekolady mpitaiza marary saina.
In order to sustain community-level hygiene education, it is important for the instructors to monitor and follow up the activities. In this way, as hygiene education activities advance in the Atsimu-Andrefana region, instructors from health centers now make home visits and actively teach about hygiene and sanitation. More women are now wearing this wrapping garment printed with hygiene messages. Other behavioral changes can also be observed in relation to sanitation, such as communities constructing their own latrines. Next, we will take a look at the community-based activities of volunteers dispatched by JICA. The activity is hygiene education for anyone in the community, from children to adults. Easy-to-understand pictures illustrated on large cloths explain infectious routes of parasites. They demonstrate how to wash hands using soap. Card games are used with illustrations that show hand washing and other correct behaviors. And then there's the hand-washing dance to improve hygiene awareness. This dance and song was created in collaboration with one of the top artists in Madagascar in order to help spread the word. These participatory programs are based on preparatory studies of the habits and lifestyles of the local people, so as to make them most interesting for them.
Zavatra tsapako zany a dia ilaina le fanaovana an'le izy indrindra eo amin'ny fahasalamana
Ie, faly be zay. Nafinaritra ny zavatra nataonareo.
Manentana ny namana ny akaiky rehetrarehetra.
Let's consider a few that are necessary to ensure a sanitation project to be effective and sustainable. In order to improve rural sanitation, in addition to the access to water supply and sanitation facilities, it is also necessary to improve hygiene behaviors of the people. To do this, an effective mix of hardware and software measures is required. In both aspects, an understanding of cultural and social backgrounds and practices in the area is important. For example, in terms of hardware, design should consider whether people practice washing their buttocks with water after defecation. Also, safe, visible locations should be selected so that women and girls can use the facilities without fear. Structures should ensure privacy. They should be designed so that children will not fall in, and they should be easy for people with disabilities to use. As for software, hygiene education events for communities should be well notified and should be held at times and places when women, who are usually responsible for domestic hygiene and childcare, can participate. To increase the awareness of sanitation in the population and connect this to voluntary action, approaches must involve all levels, from the national government to the communities. At the national level, educational policies must be developed and cascading systems put in place to train people and build capacity. These should be implemented at a community level to ensure sustainable sanitation improvements. Simultaneously, it is important that based on the various roles of the different levels of government, a cycle of planning, implementation, evaluation, and monitoring should be institutionalized. Sanitation projects are implemented not only in the water resources sector, but are carried out across various sectors of basic education, primary health care, and rural development. In many countries, it is unclear as to which ministries are responsible for rural sanitation, and it is important that these roles are clarified in order to increase the effectiveness of cooperation and coordination between ministries. And since other donors and NGOs may have other approaches, it is important that information is sufficiently exchanged between donors. Improving rural sanitation is thus more than providing sanitation facilities. Raising the awareness of local people is important while giving respect to their opinions. By effectively appealing to the community pride, this will lead to people taking action on their own.